This content is for informational purposes only and does not replace professional medical advice. Always consult a qualified healthcare provider for personal health concerns. You reach for that second, or perhaps third, cup of coffee, searching for a spark that simply refuses to ignite. It is a quiet, creeping frustration, a sense that the vitality you once took for granted is slowly slipping through your fingers. You might notice your drive in the gym hitting a plateau, or perhaps you find yourself distracted and irritable when you would rather be focused and present with your loved ones. Recent data indicates that a significant number of men are navigating these exact symptoms, often brushing them off as an inevitable byproduct of aging. But what if there is more to the story than just the passing of time? There is a growing conversation surrounding the decline of hormonal health in modern society, and for many, the culprit hiding in plain sight is testosterone. Research suggests that when levels of this vital hormone drift outside of the optimal range, the ripples are felt across your entire system, influencing everything from your metabolic rate to your emotional resilience. We aren't talking about overnight transformations or dramatic shifts, but rather a gradual erosion of the baseline you have come to rely on. Studies indicate that lifestyle factors, environmental stressors, and systemic health conditions can all influence how your body produces and utilizes hormones. If you have been asking yourself why your stamina seems to have diminished or why your mood feels like a pendulum, you are asking the right questions. We are here to strip away the guesswork and look at the clinical reality behind these feelings. By understanding the biological markers that signal a hormonal imbalance, we can move away from vague assumptions and toward clarity. Let us move forward and examine the specific criteria used to identify when your testosterone levels might require a closer investigation. To understand why these specific criteria matter, we must first look at the biological landscape where testosterone operates. Think of your endocrine system as a complex, internal communication network. At its heart, testosterone is a chemical messenger, a steroid hormone primarily produced in the testes for men, though it is also generated in smaller amounts by the adrenal glands. Its influence is systemic. It doesn't just govern muscle mass or libido, but plays a foundational part in bone density, cognitive function, and mood regulation. However, the endocrine system is sensitive to everything from sleep hygiene and nutritional status to chronic stress, meaning your levels naturally ebb and flow throughout the day. This is where the distinction between a temporary dip and a clinical condition becomes vital. Medical professionals define hypogonadism not by how you feel on a particularly tired Tuesday, but by a consistent, measurable physiological state. Clinically, this is categorized into two primary types: primary hypogonadism, which originates from a structural issue within the testes, and secondary hypogonadism, which stems from a breakdown in the signaling pathways between the brain and the hormone-producing glands. Research suggests that there is no singular, universal number that applies to every man on Earth. Yet, a diagnosis is rarely reached through a single data point. Because testosterone circulates in the blood in different forms, some bound to proteins and some circulating freely, doctors must assess the total picture. Studies indicate that a diagnosis of clinical hypogonadism requires both a low serum testosterone level confirmed through multiple morning blood draws and the presence of persistent, symptomatic indicators that interfere with your daily life. It is the convergence of these biological markers and your lived experience that prompts a medical professional to consider intervention. Without this structured approach, we risk misinterpreting the natural, life-stage-related decline that occurs as we age. Now that we have established what constitutes a clinical deficiency, we need to look at the practical reality of how these symptoms manifest in your day-to-day life, and why they are so frequently misunderstood. While those daily manifestations are often the first sign that something feels off, they are merely the surface ripples of a much deeper, more complex biological shift. Medical science categorizes this decline into two primary frameworks: primary and secondary hypogonadism. Think of primary hypogonadism as a failure at the source. The testes themselves are unable to produce adequate hormone levels despite receiving clear instructions from the brain. Conversely, secondary hypogonadism occurs when the testes are perfectly healthy, but the signaling system, specifically the communication between the hypothalamus and the pituitary gland, is interrupted. But beyond these clinical classifications, many men experience a more gradual, systemic decline driven by the modern environment. Age is the most predictable variable here. It is a natural transition, yet it is rarely an isolated event. It is almost always compounded by what we call lifestyle-induced hormonal imbalances. Studies indicate that obesity, in particular, acts as a significant disruptor. Furthermore, chronic illness plays a pivotal role in this equation. Conditions such as type 2 diabetes or obstructive sleep apnea do not just impact your energy levels, they exert a heavy tax on your endocrine system. It is not just about a single failing organ. It is about the body prioritizing its resources during times of systemic stress. When you start to map these root causes against your own history, you begin to see that a low reading on a lab report is rarely a random event. Recognizing whether your situation is a direct consequence of age, a secondary side effect of a metabolic condition, or a lifestyle-driven imbalance is the most critical step in determining how to reclaim your vitality. Now that we have identified the why behind the decline, we need to examine the diagnostic process itself, specifically, the precise testing protocols that separate a temporary dip from a chronic deficiency. While the diagnostic process provides the clinical evidence we need, it is often the daily lived experience that acts as the earliest warning system. Many men mistakenly assume that a drop in testosterone is exclusively tied to their sexual health, but the reality is far more systemic. Begin by observing your metabolic markers. Research suggests that as testosterone levels wane, the body often struggles with insulin sensitivity, which frequently manifests as stubborn adipose tissue, specifically around the midsection. You might find that even with consistent training and a clean diet, your body composition is shifting in ways that feel resistant to your efforts. If you notice a persistent loss of lean mass despite maintaining your strength training routine, or if your recovery times between sessions have lengthened significantly, these are important indicators that your endocrine system may be signaling for support. Beyond the physical, there is the often overlooked cognitive component. Many men report a persistent sense of mental static, a brain fog, that makes complex problem-solving or sustained focus feel like wading through deep water. When these levels dip, you might experience a decline in your ability to maintain sharp mental acuity throughout the workday. This cognitive fatigue often pairs with subtle mood shifts. You may notice an increased baseline of irritability, a reduced threshold for stress, or a creeping sense of lethargy that feels fundamentally different from simple physical tiredness. These changes are rarely sudden. They are usually incremental, which is precisely why they are so easy to dismiss as part of getting older. However, when you stack these symptoms, the metabolic resistance, the cognitive slowing, the mood volatility, and the physical fatigue, a clearer, more holistic pattern emerges. It is a constellation of markers that tells a story of a system struggling to maintain its optimal baseline. Now that we have mapped out the physical and mental landscape of these hormonal fluctuations, we need to look at how medical professionals actually interpret these signals through blood chemistry and specialized testing. Once you and your physician have established that your blood chemistry confirms a clinical deficiency, the roadmap toward restoration begins. Before reaching for exogenous interventions, research suggests that the foundation of your endocrine health is built upon the pillars of your daily habits. Consider your sleep architecture first. Studies indicate that even minor, chronic sleep deprivation acts as a potent suppressor of nighttime testosterone production. Similarly, your nutritional intake serves as the structural scaffolding for hormone production. While no single superfood acts as a magic bullet, avoiding processed inflammation and maintaining a stable body composition are proven methods to improve the bioavailability of the testosterone you already produce. Physical activity, specifically resistance training, sends a powerful signal to your system that strength and vitality are necessary for survival. However, there is a balance to strike. Overtraining can actually spike cortisol, which acts as a direct antagonist to testosterone. Yet, there are instances where lifestyle optimization reaches its ceiling. When your physiological baseline remains suppressed despite your best efforts, medical professionals may discuss testosterone replacement therapy. TRT is a commitment to a protocol designed to bring your levels back into a physiological range, not to achieve superhuman metrics. The objective is to stabilize your levels, mimicking the natural rhythm of your body as closely as possible, while carefully monitoring your red blood cell count, prostate health, and estrogen conversion. It is vital to understand that beginning therapy is a diagnostic process in itself. It is a collaborative partnership between you and your healthcare provider, requiring patience and frequent monitoring. We must look at what you can realistically expect in the months and years following a diagnosis, and how to maintain these results for the duration of your life. Looking ahead, the landscape of hormonal health is shifting rapidly. We are moving away from a one-size-fits-all approach toward personalized medicine, where genetic markers and individual metabolic profiles guide treatment strategies. Emerging research is currently investigating how microadjustments in lifestyle, combined with sophisticated, bioidentical delivery systems, might one day allow for more precise endocrine balancing with fewer side effects. Scientists are also exploring the long-term impact of hormone optimization on cognitive function and cardiovascular longevity, suggesting that maintaining healthy levels may be a cornerstone of healthy aging rather than just a remedy for specific symptoms. However, the foundation of this progress rests entirely on your willingness to engage with professional medical guidance. Home testing kits or anecdotal advice from internet forums cannot replace the nuance of a clinical blood panel interpreted by a physician. Your hormone levels are dynamic. They fluctuate based on stress, sleep, and seasonal shifts. A doctor does more than just read a number on a page. They synthesize your symptoms, your health history, and your lab results to ensure your approach is both safe and effective. To summarize the path forward, remember that managing your testosterone is a marathon, not a sprint. The essential takeaways remain consistent. Prioritize restorative sleep, nourish your body with nutrient-dense whole foods, manage your chronic stress, and maintain a consistent physical activity routine. These pillars create the environment your body needs to function at its best. Beyond these daily habits, the most vital step you can take is to find a healthcare partner who listens to your concerns, values your input, and works with you to monitor your levels over time. There is no shortcut to hormonal balance, but by staying informed and proactive, you can take control of your vitality for the long term. This content is for informational purposes only. If you found this information helpful, please consider sharing this video with someone who might benefit from these insights, and feel free to subscribe for more deep dives into your health journey.